Video content or information here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Please also see the written disclaimer with more details below. Thank you. Hi, I'm Dr. Carrie Bennett, and today I'm going to talk to you about the staging of breast cancer. Breast cancer has been staged what we call a TNM staging. Tumor size, so the tumor, if it's less than or equal to 2 centimeters, is a T1. If it's over 2 centimeters, but up to 5 centimeters and including 5 centimeters, it's a T2. And if it's greater than 5 centimeters, it's a T3. If the tumor is invading into the skin, like an inflammatory breast cancer, or a regular cancer invading into the skin, or into the muscle behind the breast called the pectoralis muscle, then that is a T4. N is nodal status. Has it gone to the lymph nodes? We check all the lymph nodes behind your ears, underneath your chin, above your clavicle, but most commonly breast cancer will spread to the armpit lymph nodes, which is why we do the sentinel lymph node biopsy. And we'll talk about the sentinel lymph node in a different video. And M means metastases. Has the breast cancer spread to a distant location or been metastatic? Breast cancer, like colon and lung cancer, goes to usually 4 places: the brain, the bone, the liver, the lungs. So if it's spread to the brain, the bone, or the liver, or the lungs, that's what we call an M1 disease, and that would put you into a stage 4 category. Stage 4 disease used to be very deadly, but nowadays, with the multitude of medicines we have, and with the constant infusion of new information, even people with stage 4 disease live often quite a long time, for many decades. You often see commercials on TV about people. So this is a new thing that's in the last decade or so that's really been wonderful, because people live a long time with stage 4 breast cancer, but it's a chronic disease, but they still live a wonderful quality of life, and people wouldn't know if you looked at the person. The N is whether or not it's spread to the lymph nodes, and there's different levels of N, and you might be able to see a picture of that here. But basically the bottom line is that if it goes into the lymph nodes, we want to know, is it in just a teeny bit, and is the lymph node doing what it needs to do, which is vacuum out? And so you might find a few cells or less than 2 millimeters of cells in the lymph nodes, and that is just because the lymph node is doing what it needs to do. But if it's greater than 2 millimeters or invading into the whole lymph node or through the cortex or the outside, sort of the bean shape, it's like the outside of a bean of that lymph node, then that would be an N1 disease. And if it's all mushed together, it might even get to be what we call matted or N2 or N3 disease. And that would increase your stage to stage 2 or 3. Again, you can look at the table here. The tumor I've gone through, it's based on the different sizes of it. But we now have a new thing that we've added in, and that is the grading of breast cancer. And forgive me while I pull this up on my phone, but because this is new, you have to use this app or some kind of computer-generated algorithm to help you figure out staging. And it's based, again, and it might be backwards because of the video, but it's on the TNM. But then you'll see there's a G there. That's the grade. Grading is when the pathologists look at the slide. Grade 1 means it looks more like normal breast tissue. Grade 3, it means it looks less like normal breast tissue. And grade 2 is somewhere in the middle. So it takes into account the tumor size, the nodal status, whether or not it's spread, and the grade. It also takes into account the receptors that we've talked about: estrogen, progesterone, and HER2, HER2. We look at that, we plug that in, and that will give us an anatomic and prognostic stage. Also later, you'll look at the oncotype talk. The oncotype will affect things in the pathologic stage. So initially, we usually just take into account the physical exam, the ultrasound, mammogram, and possibly the MRI to give you a clinical stage. And then we add in the grade and the receptor statuses and look at this algorithm, and it tells us, even though your anatomically one stage, what is your prognosis? Because nowadays the prognosis is so much better with less surgery, less radiation, and a greater variety of medicines with much less toxicity. And then after surgery, we check the genetics of your tumor, and that helps us also stage and gives you the anatomic or pathologic stage as well as your prognostic stage. And if you want to look at what that app looks like, it's this little kind of baseball. It's called Breast TNM. And you can always just download it and enter in all your own information and get information about your tumor and then talk to your clinician about it. The staging of breast cancer will also give us an idea of what your prognosis is. When I became a surgeon, even stage 1 cancer was not 100% survival, but in this day and age, stage 0, stage 1, and even stage 2 with treatment pretty much have 100% survival. So it's good news. Being a breast surgeon with the staging is great because even if my patients have metastatic disease, they're still going to be around a long time. So that is the staging of breast cancer. Thank you.